Okay, everybody, quick update before I head in for shift tonight. Third 12-hour night in a row. I'm doing 5 shifts a week, which is okay because just living in a hotel, man. But it's busy. Um, it's busy. I've never had 3 or 4 ICU patients at a time, and that's how it is now. Um, just some sad stories. The ICU I was on last night had two that were pretty sad. One of them is one of the doctors who works at the hospital is in there on the ventilator, and they're talking about how he was fighting going on the ventilator because he knows what the statistics are for that, and so he's there and he works there. And then another patient, her husband has died, and then her family wants everybody to do everything they can to keep her alive, but they did a CAT scan of her, and she has clots basically kind of all over her brain. There's not much to do, but they want to do everything because they've already lost one parent. So, um, and then because you can't have family, I mean, you see the physicians FaceTiming with people when somebody's going to pass and letting them know what's going on and everything. So, the staff at New York Presbyterian Queens are super grateful and super nice to everybody who's come here from out of state. Um, I basically work with other people who are from out of state most nights. There'll be one or two people that are there all the time, but there's a lot of us from all over the place, and everybody's getting everything done, which is nice to say. I mean, it's a challenge because they put you on a different unit every night. Things are in different places. All the patients are almost exactly the same. The people who say that they're fudging the numbers on the number of people who die of coronavirus, if you see a patient on coronavirus, you know what that looks like. And they have positive tests, and they're hypercoagulable. They throw blood clots all over the place. They're on heparin. They need to be sedated in order to not fight the vent and be able to breathe effectively. And they're on super high peak end expiratory pressure, or PEEP. Usually you set PEEP at 5 or 10. I've had several patients with PEEPs at 25, which is practically unheard of. And there's a bacterial infection that has started spreading going along with this called Acinetobacter. So that just compounds everything. Everybody's on vitamin C, everybody's on tube feedings, everybody's on bowel meds. Um, and There's an antiviral they're all getting, and it goes in over 3 hours. And you spend a night shift with 3 or 4 patients fixing ventilators and um, beeping picky IV pumps and keeping your patients stable so that they can recover. And so you can see the fatigue on the people who've been here for a long time when they used to have to take 6 or 7 patients, and now we're down to like three. Sometimes you just get two. I usually get three. But that's just what's kind of going on. New Yorkers are just embracing everybody, and it really helps because it's kind of a grind at work. So I have tomorrow off, so I'm going to rest. They tell you not to work too much, otherwise your immune system gets down. So I'll be doing 3 on, 1 off while I'm here, and then make sure and get a bunch of rest and make sure I eat good the whole time. And that's just how it's going to go until I go home. I'm a little sad that on Sunday I'm not going to be there to pick up new bees and help the new beekeepers get their new bees, but there'll be a lot of years for that in the future, and they need people here now. So um, maybe I will catch up with you guys some more tomorrow. See ya. Stay safe.